afternoon and welcome to a celebration of life honoring breast cancer survivors. I am Willie Smith, chairperson for the Breast Cancer Awareness Month Committee for the Las Vegas Alumni Chapter of Delta Sigma Theta Sorority Incorporated, and your host for this event this afternoon. Breast cancer does not discriminate. Whether we've faced it ourselves or someone we love has, almost everyone has been affected by breast cancer in some way. The American Cancer Society is a national charitable partner with Delta, and we are honored to support them in the Making Strides Against Breast Cancer initiative. We also actively support other organizations in the fight against breast cancer. To show our support, Deltas are wearing pink in recognition of Breast Cancer Awareness Month and support for survivors. During this event, please check the chat box for helpful information. There you will find the program brochure and a resources list. This afternoon, our goals are to educate by increasing awareness about breast cancer and sharing some of the latest information on breast cancer research and treatment, to celebrate the lives of some courageous survivors of breast cancer, and to inspire and unite us in the fight to end breast cancer. To begin the celebration, Reverend Denise Ogletree McGuinn will offer an invocation.
Good morning. These are words from a survivor that was a family member. Dear Lord, you've done so much for me. Thank you with all my soul. But I've something to ask of you. Needing your grand control, I've waged the battle and I've won, yet others battle still. For some, their journey has just begun. Please guide each in your will. I've walked this road. I've felt every single bump. I have conquered your tests. I've grown much wiser since the lump located in my breast. I see the world much differently now. I pray others will too. So many fight audaciously. So Lord, please help them, comfort them, and guide them through their journey. In Jesus' name, amen.
Thank you, Reverend Ogletree McGuinn, for that powerful word from God. Now, please welcome the Vice President of Eta Chi Chapter at the University of Nevada, Las Vegas, Soror Samara Woolfolk, who will introduce our special guest.
Good morning, and thank you all for being in attendance today. My name is Samara Woolfolk, and I am the collegiate member of the Regional Nominating Committee for the Far West region of Delta Sigma Theta Sorority Incorporated. I would like to start by introducing our first special guest, Samantha Molinero, who serves as the local coordinator for American Cancer Society, Making Strides Against Breast Cancer.
Good morning, good afternoon. I'm honored to be here on behalf of the American Cancer Society, celebrating survivors and their fight against breast cancer. I'm lucky to have worked alongside many of your members over the past few months while we raised breast cancer awareness and donations here in Las Vegas through Making Strides Against Breast Cancer. Every single survivor is living proof that your fundraising and dedication to making strides is saving lives. Everyone's contribution matters. When you commit to the fight to end breast cancer, it doesn't matter how big or small, your impact is great. We are fighting for a future where everyone has a fair and just opportunity to prevent, find, treat, and survive breast cancer. The American Cancer Society's commitment to health equity includes a $50 million investment in research to help understand cancer inequalities and create strategies for overcoming them. But there's more we can do. As we virtually gather today to celebrate life and survivorship, we think about the future. We must fund the future for me, for you, for your children, and theirs. Thank you for all you have done in the fight. Be safe, stay well, and God bless.
Next, I would like to introduce Edna Winene. Currently, Edna serves as president of the Electrifying Eta Chi chapter of Delta Sigma Theta Sorority Incorporated, Tri-State Facilitator for the Far West region, serving Nevada, Utah, and Arizona, as well as the current president of NPHC. I'm so proud to call you my soror and line sister.
Good afternoon and greetings to the wonderful guests in attendance today, sorors near and far, and to the fabulous Far West Regional Director, Soror Tracy Ricard Akins. I am Edna Winene, the president of the Electrifying Eta Chi chapter of Delta Sigma Theta Sorority Incorporated. We are located on the campus of the University of Nevada, Las Vegas. We are a small but mighty chapter. And on behalf of my chapter, I would like to welcome you to our celebration of life, where we celebrate the lives of those who have lived and survived breast cancer, a disease that many Black women live with and face every day. I encourage you all during this month of breast cancer awareness to go get to the doctor and get checked out. I am very excited for this event. It is a wonderful time where we get to fellowship and learn from our fellow sorors, as well as esteemed guests, and celebrate this day that the Lord has made, and let us rejoice and be glad in it. I am very excited to be here, and I hope you enjoy the rest of the day. Thank you.
I now have the pleasure of introducing the current president of the Las Vegas Alumni Chapter, Belinda Marintic, who also comes from the Electrifying Eta Chi chapter. Soror Marintic has the additional responsibility of serving as the e-learning chair for the Far West region. Eta Chi is so proud of you, Soror Marintic.
Thank you, Soror Woolfolk. To our esteemed chair of the National Program Planning and Development Committee, Soror Jeffries, our Regal Regional Director, Soror Akins, our sensational special guests, my savvy sorors in the audience, our friends, family, and guests, good afternoon. My name is Belinda Marintic, and I have the honor and privilege of serving as the president of the loving, lively, and luminous Las Vegas Alumni Chapter. LVAC, as we affectionately refer to ourselves, has over 200 members that cover the greater Las Vegas Valley, including Las Vegas, Henderson, and North Las Vegas. We are an innovative and trailblazing chapter in the Far West region and the second largest. We were chartered in Las Vegas in 1966, and for almost 55 years, we have been working tirelessly to ensure our community understands the importance of education, physical and mental health, and social action, and that we leave a legacy for others to follow. I bring you greetings and welcome you to our first virtual Celebration of Life program honoring breast cancer survivors. Our program is being streamed live via Facebook, as well as over Zoom. We couldn't think of a better way to culminate Breast Cancer Awareness Month than a celebration. The Bible talks about in due season you shall reap if you faint not. Thank you, survivors and families, for not growing weary in your fight and remembering that God wouldn't put more on you than you can bear. We are thankful that He has kept you thus far and look forward to learning and growing with each of our survivors for years to come. We are excited for everyone to be here, sorors, friends, family, and guests, and for taking our celebration. Our goal is for our enthusiasm to be infectious and our information to spread for you to share with others. Good afternoon again, and thank you for being here with us.
Next, I would like to introduce Soror Andrea Jeffries. Soror Jeffries is currently chair of Delta Sigma Theta's National Program Planning and Development Committee and has served as the past South Atlantic Regional Director. She is currently a member of the Orangeburg Alumni Chapter in Orangeburg, South Carolina. Soror Jeffries worked in the vocational rehabilitation field for over 30 years, helping citizens of South Carolina and veterans with disabilities to live more productive lives. Thank you, Soror Jeffries, for your service to Delta and to the community.
Thank you. Good afternoon to the Far West Regional Director, my friend, Tracy Akins, to all of the sorors, officers of the Las Vegas Alumni Chapter and the Eta Chi chapters of Delta Sigma Theta, and all of our special guests, good afternoon again. I am Andrea Jeffries, Chair of the National Program Planning and Development Committee, and I am so grateful to bring greetings today on this occasion. What a wonderful time to celebrate life. We never give up. We never lose hope. We keep the faith. It allows us to cope. Trying times will come and go. They always somehow do. Just trust in God. Remain steadfast in His word. He will bring us through. Smile each day. Strive to live beyond the challenges and pain, knowing in our hearts, through Christ, our strength is gained. SOARs, we are here to honor our breast cancer survivors, those audacious, bold, courageous, and daring SOARs who stand before us today as a testimony of God's grace, mercy, and enduring love. SOARs, you are an inspiration to all you know, walking in faith and seeking God's strength. Because of God's love, we are not consumed, and his compassions never fail. There are new mercies every morning, and we are reminded of how great is his faithfulness. Today, we pause to recognize you, SOARs. You are braver than you believe, stronger than you seem, smarter than you think, and twice as beautiful as you've ever imagined. Breast cancer is the most common cancer in American women, except for skin cancer. In 2020, an estimated over 270 new cases of invasive breast cancer will be diagnosed in the women of the United States, as well as over 48,000 new cases of non-invasive breast cancer. Tragically, this year, it is estimated that there will be 42,000 women who will die from breast cancer in the United States. But through increased preventative and educational measures like this program today, we celebrate the over 3.5 million breast cancer survivors in the United States. Maya Angelou reminds us that the best part of life is not just surviving, but striving with passion and compassion and humor and style and generosity and kindness. My SOARs, you are conquerors. You remind us that our faith is bigger than our fears. You teach us that we never know how strong we can be until being strong is the only choice. Like the splendor of a pearl, you shine brightly for all the world to see. Jewels in our Sigma, women of DST. God bless you, and thank you again for inviting me to this program, and I hope that you enjoy the rest of the program. Thank you.
Now I have the extreme pleasure of introducing the Regional Director of the fabulous Far West Region, Tracy Ricard Akins. SOAR Akins is currently a member of the Phoenix Metropolitan Alumni Chapter. Her passion-filled work in Delta Sigma Theta Sorority Incorporated has touched each level of leadership at the local, regional, and national levels. In the midst of her purpose-driven life, along with the work of Delta, SOAR Akins graciously conquered 2 surgeries and radiation treatment after being diagnosed with thyroid cancer. Her service, dedication, and perseverance are most admirable. We thank you for all that you do, SOAR Akins.
Thank you, thank you, thank you. Pink, pink, and more pink, but it certainly looks good on each of you today. I am Tracy Ricard Akins, your Far West Regional Director, and on behalf of the 94 chapters in this region, I greet you to say good afternoon, my SOARs, family, and friends. Thank you so much for inviting me today. To our host chapter president, SOAR Marintic, event chair, SOAR Smith, National Executive Board guest, SOAR Jeffries, and all special guests. Today, we are celebrating life for all breast cancer survivors. But my heart would not be at ease if I didn't acknowledge those we have also lost to breast cancer. It was 2 years ago, on July 16, 2018, I lost my goddaughter, Naya Santos. I am happy today because her mother sits beside me, and not often, if ever, I have the chance to mix Delta with my best friend of over 40 years. But here we are. Yes, she lost her daughter, Naya, who was only 26 years old. But my best friend still finds joy in every day and remains the life of the party. Although Naya is gone, we still celebrate her life and keep her memory fresh so her 3 boys will always remember their mother. So today, as we continue to celebrate life, Tracy and I, that's right, she's a Tracy too, TNT, we will celebrate Naya. Thank you, Soar, so much. Have a great afternoon. Enjoy the celebration.
Thank you, Soar Akins, for those heartfelt and inspired remarks. We appreciate you and all of our special guests for our contribution to the program. Now, Dr. Katrina Haslett, Chair of the Physical and Mental Health Committee, will introduce our keynote speaker.
Good morning, soars and guests, or shall I say good afternoon. I wish to introduce our keynote speaker and moderator, Dr. Amelia Doway, our esteemed SOAR. Dr. Doway is someone who, at one time, gave me advice to help me make a life-changing decision. And I thank and think of her with every breath that I take. Dr. Doway is a graduate of Johns Hopkins University and the University of Illinois College of Medicine. After completing her internship and residency in surgical oncology at Moffitt Cancer Institute at the University of South Florida, specializing in breast surgery, she is an expert in the treatment of breast cancer and breast disease and was the co-inventor of a patented radioactive seed breast procedure, which localizes non-palpable breast lesions. Dr. Doway currently practices general and oncological surgery in Australia. She is the author of the book, Live Fearlessly, Liberating Your Life After Breast Cancer, and believes in removing cancer and also restoring the entire patient physically and mentally. During her 20 years of surgical practice, one of the most important lessons she has learned is that no matter how much knowledge and experience one has, it is important to continue learning and being innovative. Please welcome Dr. Amelia Doway.
Thank you, Katrina. Good afternoon, everyone. Thank you, Katrina, for that introduction. I'm very excited to be here to participate and have the opportunity to participate in this celebration of life. I would say that in the past 21 years, my journey in treating breast cancer patients has been quite exciting to witness the evolution of diagnostics and to witness the advancement of the treatments of breast cancer globally. Through research, we're learning more and more about breast cancer, and we're developing more effective and innovative treatments. Today, I'd like to share with you a few facts about breast cancer, where we are today with our treatments, but most importantly, whether you've experienced breast cancer or not, I want to share with you some of the things that we can all be doing to live well and fearlessly. In the US, 12% of women will develop breast cancer in her lifetime. That's about 1 in 8. And that varies depending on race, ethnicity, family history, and other factors that we'll talk about shortly. As mentioned previously, in this year, 2020, there'll be approximately 276,000 invasive breast cancers and about 48,000 non-invasive breast cancers that are diagnosed. The good news is that the death rate from breast cancer has decreased to approximately 2.6%. However, in African American, we see a 40% higher mortality. The other good news is that we see survival rates exceeding 90% at 5 years. So there's 3 factors that we can attribute to the decrease in mortality that we're seeing. Increased awareness. So we know that the use of self-breast examination, educating women about risk factors so that we can practice more preventative behaviors have increased or decreased our mortality. Earlier detection, mass screening programs with mammography, we also understand and have learned that if we diagnose breast cancer at an earlier stage, that is easily treatable and curable. And then of course, advancement in all of our breast cancer treatments. So we use a multimodality, a team approach in treating breast cancer. So I'd like to focus on those 3 aspects which have had the most impact on and significance on survival. So in terms of risk factors and what we need to understand about risk factors, the biggest risk factor for developing breast cancer is just the mere fact of being a woman. But I would like to say that 1% of breast cancers do occur in men. So our sons, our fathers and brothers, husbands are all also at risk for breast cancer and need to be self-aware. The second thing is aging. So as we age, we always think about aging as the change of the color of our hair, skin texture, but we're aging internally as well. So we have to take care of our internal organs, but that included in that is our immune system. So as we age, our immune system doesn't function as well as it used to. And so sometimes we get cellular genetic mutations and little mistakes that are made, and the immune system doesn't catch those mistakes. So as we age, we're more prone to developing breast cancer as well. Family history is also an important risk factor. However, I will say that the majority of breast cancers that are diagnosed are sporadic. In other words, the woman does not have a family history for breast cancer. However, those that do have a very low likelihood of having actually a genetic mutation. Only about 5% will have a gene attributed to breast cancer. And the two most common genes are the BRCA1 and 2 genes. And then next would be our reproductive history. So we know in the US that women who never have experienced pregnancy or those who have a late first pregnancy are at higher risk than those that don't have those reproductive history. However, I will say that in other parts of the world, those risk factors are not the same. For example, I was in Nepal a year ago doing some work, and they actually will have a higher risk of breast cancer if they have children at an earlier age in multiparity. Also environmental factors. So some of the environmental toxins that we may be exposed to in our foods or just in the environment that we're in also can potentially impact our risk for breast cancer. But the most important risk factor that I want to focus on next would be our lifestyle, because 30% of chronic disease can be attributed to health behavior. So I'd like to focus more on that. So the National Institutes of Health have identified 5 of the most common high-risk health behaviors that can lead to chronic disease, such as heart disease, diabetes, hypertension, high blood cholesterol, and cancers, particularly breast cancer. The first would be tobacco use, so smoking, physical inactivity. We know a sedentary lifestyle can be unhealthy, which leads to being overweight and obesity. So we know that obesity is increasing globally, poor diet, and then excessive alcohol use. So I just want to get into those a little bit more. So we know that we have a 30% reduction in mortality if we increase physical activity for breast cancer patients. So we just want people to get moving. It doesn't mean you have to be a marathon runner or a triathlete. Just getting out and walking and doing gentle exercise and just getting yourself moving is really important. It also helps, again, to maintain our weight. Our diet. So we want to eat more of a plant-based diet, fruits and vegetables, and avoid processed foods, because there's toxins sometimes in the preservatives that are used in processed foods, so they have an extended shelf life. So eating a cleaner diet with more fresh fruits and vegetables is a preferred diet. It also helps to maintain our weight. So I keep going back to weight and obesity. So the reason obesity is, besides being bad for our heart and other organs and predisposing us to diabetes, is because actually in postmenopausal women, the fat cells, if you look at them under a microscope, and some of our testing and research has shown that those fat cells have a crown appearance. They look like little crowns. And we found that those particular types of fat cells actually cause aromatization of estrogen. So estrogen is the female hormone that causes breast cell proliferation. And those crown cells in postmenopausal women are increasing estradiol, circulating estradiol, which increases the risk for breast cancer. So maintaining a healthy weight, particularly after when you reach menopause, is really quite significant. And then, of course, drinking alcohol in moderation. It's okay to drink alcohol, but not excessively. And then avoid smoking of any kind. And I say of any kind because we now have legalized substances where people kind of want to debate with me and say, well, it's natural. Well, tobacco is natural too. It's grown in fields and in our environment. Our lungs just like fresh air and nothing else. So avoid smoking. So I can't emphasize enough the importance of healthy behavior, and literally you are what you eat. So maintaining physical activity, Eating healthy, maintaining a healthy weight is crucial to our longevity, not just for breast cancer, but just for our overall well-being. And it's something that all of us can do better. Early detection. So that's the second aspect that's really impacted survival. Self-breast examination really should start at the age of 20. And we should always teach our children and our young girls and boys to pay attention to themselves. If you have pain in your hip or knee that doesn't go away, you would go to the doctor and get it investigated. The same is true of our breasts. So you want to get used to what your breasts feel like. I know a lot of my patients will say, well, they're lumpy, I don't know what I'm looking for. But if you get used to examining yourself consistently once a month. If you're premenopausal and still have a menstrual cycle, you want to do that a week after you complete your menstrual cycle, because it's during your reproductive years, your breasts will change depending on hormone fluctuation. And if you're postmenopausal, you just pick a day of the month that you can remember. There's probably in this day and age an app for that. So you want to examine your breast for anything that's out of the ordinary. And if there's something that's out of the ordinary and it persists, then you want to get that checked out by your doctor. And then clinical breast examinations by your doctor. So when you're getting your well woman check annually and getting your blood pressure checked and so forth, that should include a breast examination. And then there's our breast imaging modalities. So a lot of women will say, there's nothing, I don't feel anything, I feel fine, I feel great. Why should I go looking for trouble? So a mammogram is an x-ray of the breast. It uses low dose radiation, so it's less than a standard chest x-ray. So it's very safe. We do mammograms serially, meaning year after year, or in Australia, we do it biannually. And basically what we're doing is we're looking at those films side by side, year after year, to see if there's any subtle change that we can identify that would warrant a biopsy. And then when we find those cancers, they're quite small and so easy to treat with less invasive and aggressive treatments. Ultrasound is another modality, imaging modality that we use, which uses ultrasound waves. And it's really useful, particularly in younger patients, to differentiate between a lump being solid or cystic or fluid filled. And then our last modality, or another modality that we also commonly use, but we don't use it as a screening tool, is breast MRI, which uses magnets. So an MRI for breast uses a special magnet just for the breast. And basically the woman is lying down, and it's just a 15-minute procedure, and we actually can take images of both the breasts at the same time, and it actually helps sometimes complement the other imaging modalities and helps us to define a known cancer and helps us with surgical planning. So I want to emphasize paying attention to ourselves with intention. So mindfulness, we hear a lot about mindfulness in social media now, and John Kabat-Zinn, Dr. Kabat-Zinn, he developed or introduced mindfulness in modern medicine in the 1970s, and he introduced it into medical schools and hospitals throughout the United States. And there's about 250 programs in the US where we're teaching patients to practice mindfulness. So mindfulness, according to Dr. John Kabat-Zinn, is paying attention without judgment on purpose, as if your life depended on it. So it's just starting to pay attention. Our bodies are always communicating with us each and every moment. The question is, are we listening to what is communicating to us? So when you eat something and it doesn't agree with you, you start to learn that maybe dairy products, you're intolerant or something like that. So that's just a small example, but just taking time to pay attention to yourself. How does your body feel? How does your mind feel? And then breast cancer treatments. There are so many breast cancer treatments, which is quite exciting. There's surgery, there's chemotherapy, there's radiation, there's hormonal endocrine therapy, there's biologic targeted therapy, and then there's immunotherapy. Sometimes we use a combination of these, a multimodality approach, but the cornerstone of treatment is still surgery. And surgery has come a long way. Just in the 21 years that I've been practicing, we do know now that breast preservation in the form of a lumpectomy, just removing the cancer with a margin of normal breast tissue followed by radiation, is equivalent to a mastectomy in survival stage for stage. So in other words, if I had an identical twin and we both had breast cancer, all things being equal, and she chose to have her breast removed and I chose to keep my breast and have a lumpectomy followed by radiation, we're going to live exactly the same amount of time from our breast cancer. So actually most women who are getting their screening, we're identifying breast cancer at an earlier stage, actually have treatment options and a choice that they can make, which is quite exciting. Oncoplastic surgery is a marriage of surgical oncology principles and plastic surgery. So some women, as a woman ages, our breasts kind of go a little south. The nipples are looking a little downwards. So we're able to actually offer women a large lumpectomy, and we can lift the breast and reconfigure it and sometimes make it look better than it did before they had breast cancer. And of course, we do the opposite breast for symmetrization, so they have a greater aesthetic outcome and greater symmetry. So that's an option as well for some women. And then a procedure that I developed 19 years ago called seed localization. At that time, we were using radioactive seeds because as we were doing more and more mammography, we were finding cancers that were so small that the surgeon, we can't see or feel them at the time of surgery. So we needed a guide. And in 1976, a doctor by the name of Dr. Frank developed a hook wire that we placed into the breast under ultrasound or under mammography. Unfortunately, sometimes those wires can migrate, they can slip out, they can be cut, and we were removing unnecessary amounts of breast tissue. So myself and a professor at Moffitt Cancer Institute in 1999, we developed and patented a procedure using radioactive seeds that were used in prostate cancer. We were using them at lower doses to identify breast cancers that we could not feel. Fast forward now, 2 years ago in the UK, they developed more innovative seeds, magnetic seeds, which is what I use now. And I was the first to introduce that technology into Australia, where we're using mag seeds. And you can see in this picture here, I'm using a probe in the breast to identify a fancy metal detector. So we're placing a seed the size of a grain of rice into the lesion or next to the lesion, and then I can plan my incision so I can have the best aesthetic outcome as well. And I use a probe to guide me to the lesion. And then breast reconstruction for women who choose to have a mastectomy, because it's not wrong to have a mastectomy, or sometimes it's the preferred method of treating the breast cancer. We also offer breast reconstruction. So we do a variety of different types of mastectomy in this day and age, and we have different types of reconstruction using breast implants as well as using the patient's own tissue. Our medical oncology colleagues have also had significant advances, and actually we can attribute a lot of our survival from treatments to our medical oncologists. We now understand that all breast cancers are not the same. We have different tumor biologies. And when we talk about tumor biology, we're talking about surface receptors and surface proteins. Receptors are little tiny doors or special windows on the cell surface of the cancers. If a patient has those special receptors for the female hormones, estrogen and progesterone, then they're candidates for something called hormonal endocrine therapy, which is a pill that you can take to reduce your chances of breast cancer in the future, not only in the affected breast, but in the contralateral unaffected breast. We also have we have surface proteins called HER2/neu. If that's overexpressed, then those patients are a candidate for targeted biologic therapies. We're also doing chemotherapy before surgery, sometimes to shrink the tumor to make it amenable to breast preservation, but also we know that HER2 positive patients and what we call triple negative patients that are triple negative have no receptors, no surface proteins, and actually triple negative can occur in any woman, but it's more prevalent in African-American women and younger women, and is more associated with genetic mutation as well. Those are all different types of tumor biology, and we approach how we treat them differently. So there's different chemotherapy regimens that we use for triple negative versus HER2 positive. HER2 positive, we now have a new drug called TDM1 that has a 50% reduction in recurrence for all patients who took that drug that were HER2 positive. So it's a very exciting time for our medical oncology colleagues. And then of course, radiation, we also have made great strides in our radiation. We typically give whole breast radiation, which occurs over a 3 to 6 week period daily, Monday through Friday. My patients always say, oh, I'm so tired. And I said, are you tired because you have to go and find a car park for this 5 to 10 minute treatment? But you can get a little bit of fatigue after radiation. But we now have innovative treatments for radiation. We started off with interstitial radiation, where we use multiple catheters in the breast to just deliver local radiation. But then we evolved and developed a balloon delivery system, which we no longer use really anymore. And now we use the Savvy catheter for those patients who are appropriate candidates, where we use a multiple strutted catheter that we place into the lumpectomy cavity, and the patient gets radiation twice a day for 5 days. And we found that the patients have similar results to external beam radiation. And then we also have intraoperative radiation that we offer at the time of lumpectomy for highly selected patients. So as you can see, there's so many treatments for breast cancer, and we use different treatments for different reasons. We use a combination of things to approach this problem. For women, though, it's really important for women to be offered treatment options. A woman doesn't have a choice in having breast cancer, but she does have a choice in how she chooses to respond. And so although we have a team approach to treating breast cancer with the surgeon and the medical oncologist and the radiation doctors, the most important team member is the patient. And so it's important that we educate patients about what those treatment options are and what the advantages and disadvantages of each one, so that they can make an informed decision instead of a fear-based decision and make an empowered choice. But many women will have the strength at the time of diagnosis and the strength to get through all of the multitude of treatments that we throw at the breast cancer. But many women, and I think a lot of us as physicians sometimes neglect to realize this, is that after treatment's been completed, they have a lot of struggles. We have a lot of sometimes side effects that are constant reminders of the breast cancer experience or journey that they've been on. And sometimes they have quite a bit of struggle mentally and physically. And so sometimes a woman will silently suffer with fear of recurrence and death from her breast cancer, even though she successfully survived the treatments and maybe a year or two out from treatment. So that's important for those of us who have never experienced breast cancer, but have a family member or friend who has gone through that journey. Sometimes they can still be struggling. So fear, when it's sustained over a long period of time, can have significant physiologic effects. We know that our fear, fight, and flight freeze reaction is stimulating our sympathetic nervous system. And when that happens and it's sustained over a long period of time, which is our stress response, we have an increase in our cortisol levels, which is our stress hormone. We also have lack of sleep when you're fearful. Our digestive system is affected. Our reproductive system is affected. If you're fearful, you're not thinking of sex and you're not thinking of eating. And unfortunately, it also suppresses our immune system, which makes us susceptible to further disease. So conquering that fear, or accepting and admitting that that fear exists, is really important. Live Fearlessly, Liberating Your Life After Breast Cancer is a book that I authored, and I wrote it with the intention to raise awareness of the impact of mindset on our mental and physical well-being and the impact of fear. It's also to raise awareness for physicians that our job isn't complete just because we've cut a tumor, we've removed a tumor, or we've treated them with treated the patient with chemotherapy. That complete treatment of the patient is a holistic approach, and to create or cultivate a mindset, or help our patients cultivate a mindset that is going to help them to live fearlessly and to live a life that's well lived. The reality is that all of us are not going to live forever. I'm not going to be here forever. You're not going to be here forever. And part of the human experience is experiencing some type of challenge or struggle. And I can't think of a life struggle as significant as a breast cancer, but a breast cancer can be quite confronting and an emotional disease. I treat a multitude of cancers, not only breast cancer, but breast cancer compared to, for example, pancreatic cancer, esophageal cancer, is a much more emotional disease. So I'm going to leave you with the words of, I'm going to leave you, or end my presentation with the words of Viktor Frankl, who said that between stimulus and response, there's a space, and in that space, there's the power to choose our response. And in our response is our growth and our freedom. So if breast cancer is a stimulus, and the response is how we choose to treat that breast cancer, that space in between is that power to choose. It's that empowered choice. We need to create that space as physicians. We need to allow the patient to inhale, take a deep breath in, and exhale out, so she can just clear her mind and think about the fact that, one, all breast cancer is treatable. Sometimes it's not always curable, but even stage 4 breast cancer, we can put a patient into a chronic disease state. They will live many, many years and almost live out their entire life sometimes, as we are in 2020. So all of us are not going to make it out of this world alive, but we want to, in our response, in those challenges, however, whatever we go through, whether it's a breast cancer experience or whatever experiences maybe some of you may even be going through today, that's where you can grow and you can find your freedom. So I thank you so much for allowing me the opportunity to participate in this important celebration of life today. So I thank you, and I appreciate you, and I hope that all beings in this day and age in 2020 are safe, happy, and healthy. The next part of our program is, to me, the most exciting part of the program. We're going to hear from the survivors that we are celebrating today. Brene Brown, we all have a story, and Brene Brown says that owning our story and loving ourselves during that process is one of the bravest things that we may ever do. So we're going to hear from, if our survivors can turn on their mics. Welcome to all of our survivors. I'd like to have a conversation with our survivors to really gain a perspective of the breast cancer experience through the lens of a survivor. So I want to start first by just asking, going back to the very beginning. So I'm going to start off with Wendy. Wendy, if you can turn on your mic and your video, I would like to ask you, how was your breast cancer diagnosed? How was it detected?
Well, I was doing a self-exam and I felt something that felt strange. It was December of 2018. I had to go for a mammogram that January, so I went, and then they felt something, or they saw something. So I had to have, let me see. They ended up doing a biopsy. They went back and forth. And then finally in June, they did a biopsy and told me that it was cancer. Well, from January to June, they kept saying it wasn't cancer. It was just full of fluid, which you mentioned earlier. And so anyway, that's how I was diagnosed.
So I think, so that's really, I congratulate you on finding your breast cancer yourself. So I think this illustrates the importance of being mindful and paying attention to ourselves and performing self-breast exams, or being in the shower, and just when you're looking at yourself in the mirror, just noticing, taking a moment to take that time to notice yourself. And if there's anything that you pick up, then to just go and get it investigated. I think that's really important. Katrina, I wanted to ask you about your experience with the beginning of your journey, because you're not only a breast cancer survivor, but you're also a gynecologist, and you treat women all the time. That's your thing. So what was it like for you to, how did you start your journey? How were you diagnosed? How was your breast cancer detected?
So that is certainly my thing, to treat women. And I wasn't used to being a patient, but my journey started, my mother's a breast cancer survivor for probably about 25 years. She wasn't getting her follow-up at that time. And me being the daughter and the doctor, I was fussing at her that she didn't do her follow-up and she needed it. And I ordered her mammogram, and to support her, even though I was 44 years old, I said, I'll go with you and get mine. Well, hers came back negative and mine came back positive. But being as an OBGYN, I got my own results. So they send them to me. They probably send them to the physician that ordered them also, but they sent them to me, and I opened them up and I saw that invasive carcinoma diagnosis. And that is just a preliminary diagnosis at that time. And that was very earth-shattering for me. It took me a little while to believe that those words were for me, because I was so used to having to tell patients those words and be compassionate and listen. It was very difficult and an emotional thing that had happened. I did have a lot of support in the community and with my family, though.
Yeah, that's great. I think that that is important to understand, that breast cancer does not discriminate, that all of us are human and we all are at some point in time, even those of us who are physicians, I've been a patient myself, that we're all going to experience some type of physical challenge in the form of illness and disease at some point in time in our lifetime. So I congratulate you for getting your mother to get her mammogram, and thank God for that you did as well, so that they could detect your breast cancer. Jacqueline, would you care to share how you came about your diagnosis as well? Because I know that you're also a healthcare professional. Would you care to share your beginning of your journey?
Yes, thank you. I have the great honor of working in breast cancer here in Las Vegas in a diagnostic center where I work up patients for lumps and abnormal mammograms. Mine was diagnosed on a simple screening mammogram. It happened to be done by the very mammographer that I work with daily for the last several years, and was sent to my lead radiologist. He didn't know it was my mammogram in particular, and just saw a very, very subtle change in some fibroglandular tissue. Subsequently sent me to my very own center to have an ultrasound and then biopsy, and was found to have a very small and early invasive cancer. So it was very humbling and to be on the other side of the very thing that I do all day, every day.
Thank you for sharing that. Naomi, would you care to share your experience about how your journey started with breast cancer?
Yes, good afternoon. 18
Good afternoon.
years ago, I went for my yearly mammogram and a lump was discovered in my breast. And the doctor recommended a biopsy to see if I was cancerous. And sure enough, I was. I went for a lumpectomy in November of 2002. And after radiation and taking the Lord into session and surgery, I never was afraid. My family took the diagnosis harder than I did, but I knew I'd be healthy again. So I rely on Proverbs 16:3. Commit to the Lord whatever you do, and your plans will succeed. So that's where I am now.
Oh, thank you so much. Thank you, Naomi. That's great. I think that this illustrates the importance of our faith, but also importance of the fact that these women have not only paid attention to themselves, as Wendy has done a self-breast exam and detected her breast cancer, but the importance of screening mammogram, that you don't have to have a symptom. There's so many women that will say that I don't feel anything, I feel fine, but we're looking again to do mammography earlier rather than later so that we can detect breast cancers when they're quite small and easily treatable and potentially curable. I'm going to go on to another question that I think is really important. And I alluded to this in my, I talked about this a little bit in my presentation in terms of empowered choice. So Tanya, I would like to hear from you in terms of when you were first diagnosed with breast cancer, were you offered treatment options? And if you were, did you have a good understanding of those options, what your options were?
Good afternoon, everyone. It's nice to be here with so many beautiful survivors. I was first diagnosed in 2003. And yes, and I actually went through a lot of prayer and meditation in making my choice. I was diagnosed with ductal carcinoma in situ. It was stage 0. I've actually been diagnosed with that twice. But in the first diagnosis, I was sent to see an oncology doctor. And we also talked about radiation. And at the time, I did a lot of research on the statistical information that was available. And it just was not sitting well with me and my spirit to choose radiation. So I had a choice of a lumpectomy, coupled with radiation. And the stats were just so limited in terms of how much more beneficial it would be for me to have radiation, so I chose not to have it. I went through the lumpectomy, and we watched it with a MRI and a mammogram every 6 months to make sure I was okay. Stress is a huge part of life, and you talked about that. And I think that was a huge factor in the recurrence in my case. But fast forwarding to the third diagnosis, which came 1 year after the first one, I really got into my choices with second and third opinions at UCLA and the Mayo Clinic. And I think emotionally, there's a different check-in process after the shock of being diagnosed and just wanting a doctor to fix it, which was kind of where I was in the first phase, 2003 versus 2008. So I've had choices throughout all of it, but the first one, yes, there were choices between radiation, not having radiation, and just choosing a lumpectomy. The mastectomy at that point in time was not one of my options.
Okay. Thank you for sharing that as well, your journey. I think it's important, you mentioned the stress. So one of the things I do want to say is that stress is not something that all of us have stress, and it's not something that any of us can actually avoid. So it's not a matter of avoiding stress, because happy occasions can be stressful as well. If you planning a wedding or the birth of a child, bringing a child into the world, all of those are joyful occasions, stressful occasions. So we can't avoid stress, but we can develop tools or employ tools that will actually help us to manage stress or to respond to stress in a way that is more supportive of our physical and mental well-being. I also wanted to say that I think it's very important that people understand that you do have options in terms of second and third opinions and doing your own research, because remember that you're the most important team member on that treatment team. We'll never do anything, a doctor should never do anything to you that doesn't sit comfortable with you, because at the end of the day, the patient lives with the outcome of all of our treatments, not the doctors. So the fact that you were informed and you made an informed choice about not receiving radiation, and then you ultimately made other choices probably later when you had cancer again, I think that that's important to illustrate as well. So I thank you for sharing that.
Absolutely, thank you.
And Esther, could you share your experience when you were diagnosed? Were you offered treatment options? And if you were offered treatment options, what factors did you use to make your choice? Esther?
Yes, I'm having some internet connections. If you asked me to share my...
Yes, so I was asking Esther, if you could share your experience when you were first diagnosed. Were you offered treatment options? And if so, what were the factors that you used to make your choice?
I was first diagnosed through a routine mammogram, was my regular yearly mammogram. The oncologist, the surgeon, and I had a long history. We have a long relationship because of some other issues. And she said to me after the lumpectomy came back that it was cancerous. She gave me some choices of what was possible. She told me she recommended. Because of my relationship and my trust in her, I chose to do the lumpectomy, followed by the STIVA, the 5-day radiation. And
thank you for that.
And at the time I was diagnosed, I told her God's got this. So I wasn't gonna worry about it.
Great, fantastic. So I also think, Esther, this is a great point that you had a relationship with your doctor. And I think it's important that whoever you choose as your surgeon, your radiation doctor, your medical oncologist, that someone that you trust, that the information that you're getting is you're comfortable with, and you're comfortable with your treatment team. So as Tanya got second opinions, I think that's great, but also if you have a relationship with a doctor already that has provided you with guidance over the years, that relationship is important. So it's important to trust your treating team, and it's important for the treating team actually to trust the patient as well. I'd like to ask Beverly, could you share a little bit about your experience in terms of treatment options and when you were diagnosed?
Yes, I will be happy to. Dr. Amelia, I wish that 32 years ago, some of the things that you talked to us today about, the seed and all, I wish it would have been at that time. But I am just the opposite, because I did not know any medical people that did anything with breast cancer, okay? So I actually found the doctor that treated me in the Yellow Pages. Now, you guys know how long the Yellow Pages have been out of existence, but I actually used the Yellow Pages, found this doctor, because I could not, my mindset at the age of 34, no smoking, no drinking, exercise, maintain a healthy weight that I will probably never see again in this life, yearly mammograms. I had even had a mammogram 3 months prior to being diagnosed with breast cancer. So I was just completely in awe. And I went to the first doctor. And when I went to the doctor and I was diagnosed, thank God, you know, God just leads us, guys. We just have to follow and trust. I went to the doctor, and what the doctor suggested, he said to me, he said, Beverly, you have breast cancer. He said, but what I would suggest, because I was probably just the crazy queen in front of him, right? He said, what I would suggest that you take your medical records and you go and you get a second opinion, because his opinion was to have my complete breast removed, period. So that's exactly what I did. I took the advice of the doctor that I didn't even know, but trusted through, you know, God knows everything. I took the advice, went to the breast cancer clinic right here in Las Vegas, and met another gentleman that I had no clue who he was, didn't know him, but this gentleman, just looking at my work at the doctor's medical records, he suggested the exact same treatment that I would have my breast completely removed. He said, then your mindset, your mind won't just run away with you because of the fact that you'll keep asking, did they get it all? You know, why did they do this? What? So he suggested that I also have my breast removed completely. But before I left out of his office, this guy said to me, he said, you know what, Beverly? He said, my daughter is 35. And he said, I'm going to tell you the same thing that I told her, that I would tell her. He said, I would say to her, you consult your family, your friends, your husband, everybody else. He said, but the ending consultant, you need to consult the person who made you. So I did exactly what, of course I did exactly what he said. I went to the person who made me, and I decided to have my breast removed. I also, after speaking with both, I decided to do the reconstruction. While the breast tissue was being removed, the reconstruction doctor, the plastic surgeon, he was in there with me, and he started the reconstruction process at that time.
Wow, that's wonderful.
Wow.
That's really great. So I think also that's the fact that you were able to get a second opinion, and those opinions aligned can also bring comfort to the decision-making process when you have multiple opinions and they all are on the same page and is consistent. So I thank you for that. We're gonna, I'd like to find out, you know, when you're diagnosed with breast cancer, all of us are really busy. You know, we don't, no one has time for breast cancer, okay? People have children and households to run, and they have careers, and depending on what stage of life you're in, you might even have aging parents that you're helping. So no one has time for the treatments. My patients are always like, I don't have time for this test and this, that, and the other. So during the process, there are resources that are available. I think people need to understand that there is support beyond just the actual medical treatments. And so, Diane, can you share with us a little bit about some of the resources that you were available for you and which ones you utilized? Diane?
All right, can you hear me now?
I can.
Oh,
we can all
great.
hear you.
Great. I found everything. I just researched everything about breast cancer, and I found quite a few. I just had to decide. So what I did, I decided to go with the American Cancer Society because they had so many programs, and I went with Susan Coleman and a locally club called Gilda's Club. I liked them because not only had you could go to the conferences, you could do workshops, and what I started doing was volunteering. And I volunteered all over Chicago. We had something at my church started by a lady, and I decided to do that because you all know you're gonna need God. So I had the spiritual connections too. But my biggest thing, the thing I enjoyed the most was volunteering because I could go, I went to hospitals, I went to small churches, I did the streets, whatever it took, did the walks, and I just enjoyed so much encouraging others. So then when I did that, I didn't have time to think about me that much, but I did do my treatments and everything I had. But I learned to put my mind on others and try to help my sisters feel better, because I tell you, when I got it, I was floored, but I didn't want anybody else to feel like that. So I volunteered to help others.
Oh, well, thank you for doing that. And I think that the American Cancer Society is an incredible resource because they have a long history of supporting cancer patients in the US, and particularly with breast cancer. They have a multitude of programs, as does the Susan G. Coleman. And
Yes.
I think it's great that basically your resources you found by giving of yourself to others during the process of your treatment, which in and of itself probably was healing.
Very healing. And I tell you, I still do it. I still volunteer. I would, Beyond Cancer, Living Beyond Cancer, we do something once a year. And if they find someone that's my age, then they will put us together. And my last person was from LA, California, and I'm in Chicago, but I talk to people too.
That's fantastic. So Wendy, I'd like to hear a little bit about the resources that you use, because I know when we had previous conversations, you had said that you needed to travel to get to your radiation appointments. And I know that you use resources from the American Cancer Society as well as the Susan G. Coleman, but there are other resources. There's smaller organizations as well that provide some unique services and resources. Wendy, could you share some of the things that you utilized?
Sure. After I had contacted the American Cancer Society first, and I got free rides to my chemotherapy, they offered 20 free rides, and they would send a Lyft car to pick me up and to bring me home because they did not want me to drive. Then I contacted Susan Coleman, and what they did was they sent me a whole list of organizations. There had to be at least 20 people on the list. And I started at the top and went down to the bottom. And everything that was for breast cancer that I qualified for, I went on and applied. And so I was able to get, one was called a Tata Sisterhood, because I have triple negative breast cancer stage 3. and the Tata Sisterhood is for triple negative. And so these organizations were just phenomenal. The Red Rose program, they sent out, because I had to drive for my radiation, it was like a 30 to 40 minute drive every day. I was filling up the car twice a week. I was able to drive. They sent me $400 in gas cards. And I guess they figure I needed to eat. I didn't even ask about that. They sent me $700 in gift cards to Smith. So what else? I just got phenomenal response for when I contacted these organizations. And
That's wonderful.
Yeah, the response was just wonderful. And my sorors really helped out. When I needed a ride, couldn't find one, call them at 7:15 in the morning. I need a ride, and right there, they were there.
That's wonderful. I think that's an important message in what you're telling us, is that, you know, there's a lot of resources that are available through large organizations like the American Cancer Society, as well as Susan G. Komen, but there's a multitude of resources in every community. And you don't walk this journey and have this experience alone. You don't have to anyway. Between family, friends, and your colleagues and everything, there is a multitude of community support for women who are walking that journey, walking down that breast cancer path. Katrina, I wanted to, as we start to bring our program to a close, I want to ask one more thing that I think is really important. As you all, each of you, reflect on your breast cancer journey, what message or learnings from that experience would you share to someone who's recently diagnosed or going through that journey currently, or for some of us who have never experienced breast cancer? So Beverly, could you, if you were reflecting, what message would you have to share?
The message that I would have to share, Dr. Amelia, would be, I just need everybody to remember that breast cancer does not always mean death. Early prevention is the key, making sure that you are checking yourself, and you're making sure that your family is doing actually a daily check. I had 2 young daughters, and I know the fear of what people think. When I know what I felt, I can say. I had a 7-year-old at the time. I had a 3-year-old at the time. And the part that I just would say to everybody, communicate, communicate, communicate. I told Tia and Ashley every step of the way with breast cancer. I showed them pictures of mommy before, and I showed them afterwards. But talk to your family, keep your girls, keep your boys just well informed. But just remember, breast cancer does not always mean death. And I'm here to say that 32 years later. So thank you.
Thank you. You're an inspiration to all of us. And Katrina, what message would you share for those who are walking this path now, or those of us who've never walked the path?
My message would be perseverance, keep at it, take that first step and keep going, and courage under fire. Because in the middle of the battle, in the beginning of the battle, it's really very, very scary. And you have to just pull through, and you have a boatload of people and resources and loved ones that really are pulling and supporting you. But you really have to keep that courage and that perseverance and follow it through.
Thank you. If you were to sum up in one word your breast cancer journey and a message, Wendy, what one word would you choose?
The one word that I would choose is grateful. I'm grateful that I'm here to share this story. I'm grateful for those around me who have been there for me every step of the way. And I'm grateful that I'm gonna see another 20 years at least.
Thank you. God bless. Esther, what would your word be?
My word is faith. Have faith and trust in God.
Diane, your word?
My word is conqueror, because that's what the Father said, that we are more than conquerors.
Absolutely. Naomi, what is your word?
My word is faith. Proverbs 16:3. Say, commit to the Lord, and whatever you do, you will succeed.
Thank you. Barbara?
My word is blessed.
Absolutely. Thank you so much. Jacqueline, your word?
My word is courage. It takes a lot to look breast cancer in the face, but we can do it.
And Edna, your word?
My word is strength, because so many women have been so strong over the last couple years, and they continue to show strength regardless on what they're going through.
Absolutely. I think each and every one of you, it takes a lot of courage to share our stories, vulnerability to share something so personal, but I hope that it provides faith and hope in others. I'm glad that you're able to inspire others and to raise awareness, but I do believe that by sharing our stories and sharing our words, especially as a survivor, you are providing words that'll be the page, that'll add to the page of another person's journey and in their survivor guide. So next I'd like to introduce Dr. Rebecca Rogers, the first Vice President of Las Vegas Alumni Chapter and the Chair of the Membership Services Committee, who will continue our celebration and do a special dedication to our survivors. Dr. Rogers.
Good afternoon, and thank you for joining us today for this fabulous Celebration of Life event. We are thankful for all of the survivors that joined us today. This is for you. The lesson: you came quick without warning, thoughts fade away, but return with the morning. Imagination takes over and sorrow is made real. Worry sets in and it's all I feel. But the battle is tug of war without traction. At first, the fear overwhelms her, but she won't give up. She has been made a warrior. Time seems to slow and we are forced to wait. The news comes and the angels close the gate. It's a feeling never felt before. It's not relief, no, it's so much more. I now know the power that hope can possess. It is an escape from the disasters and stress. So thank you for the hope in tribulation. Dear Cancer, thanks for the lesson. By Daniel Ritz. To the breast cancer survivors on this call, we honor you. We honor the journey that you had to endure. We honor the person and the survivor that came out on the other side. We celebrate your courage, strength, and hope that you carried along the way. We honor you. By now, you should have received a package with a gift from our keynote speaker, Sora Emilia Doway, and gifts from the Las Vegas Alumni Chapter. These are tokens of our appreciation in honor of your journey. We celebrate you. We celebrate you, Sora Katrina Haslett, an OBGYN physician who is 5 years cancer-free. We celebrate you, Sora Edna Jones, a retired educator who is 11.5 years cancer-free. We celebrate you, Sora Esther Langston, a retired university professor who is 5 years cancer-free. We celebrate you, Sora Beverly Mathis, an educator who is 33 years cancer-free. We celebrate you, Sora Wendy Smith, a customer service manager, recently completed radiation treatment. We celebrate you, Sora Diane Walker, a retired regional librarian, diagnosed 16 years ago and is 11 years cancer-free. We celebrate you, Sora Jacqueline Webster, a nurse practitioner currently undergoing radiation. We celebrate you, Sora Barbara Williams, a retired educator who is currently undergoing targeted therapy. We celebrate you, Tanya Flanagan, a public information officer for the Clark County government, but also serves as the interim executive director for the Susan G. Komen Foundation and has devoted the last 8 years to volunteering to serve women and families dealing with breast cancer. Tanya is a 3-time breast cancer survivor. As the first vice president of the Las Vegas Alumni Chapter and the chair of membership services, I just want to say thank you for allowing us to honor you today. God bless and stay safe.
Thank you so much, Dr. Rogers, for those inspiring words, that wonderful dedication and tribute of love. And thanks again to our 10 breast cancer warriors for sharing your stories with us. One of the most effective ways to honor survivors everywhere is through fundraising for breast cancer research, treatment, and services. In honor of our survivors, our local Team DST has raised $12,592. Delta chapters across the nation have raised a total of $84,686 in honor of survivors. Locally, the recipient of the highest fundraiser award for 2020 is our soror, Dr. Darlicia Alexander, who raised $3,450. Thank you, Dr. Alexander, for raising the bar on fundraising for our local DST team. There we go. You can see the fundraising award certificate that Dr. Alexander has received. Next on our program, we would like to provide another way that we can assist our survivors. In addition to the celebration and fundraising, we can support our survivors through our collective voice. Please welcome Sora Pamela Goings-Brown, who will offer practical guidance on what you can do through advocacy and social action.
Good afternoon, sorors, survivors, family, and friends. My question to you is, what else can we do in honor of Breast Cancer Survivor Month? What can we do to ensure that women's voices are heard in order to take charge of our healthcare needs? It is imperative that all women receive the full range of approved well women visits, screenings, and supplies. It is extremely important to ensure that you are not denied any coverage because you are a survivor of breast cancer. Know your rights when it comes to your healthcare plans and coverage. Be your voice and advocate for yourself and those in your circles. Share your story with others, but only when you are ready. Find a support group or join one. Empower yourself to know what's going on with your body. Be in the know with your state's legislative actions. In the state of Nevada, laws are in place to protect women from discriminatory health insurance practices, make healthcare more affordable, and improve access to many of the health services women need. I charge you to continue to motivate, to appreciate, to celebrate, and elevate those brave women, those strong breast cancer survivors. Let's uplift each other. When you donate to this worthy cause in the name of the women we've honored today, or someone you may know that you are helping to make a difference. In fact, every day, nearly 1,100 women receive free mammograms. Almost 450 receive free clinical breast exams. 250 receive free diagnostic tests, and almost 50 receive free treatment. That's why every step, every dollar, and every voice matters. So get involved today. Your voice matters. I'd like to offer that you donate to Team DST, LVAC, and Ada Chi. I'm hoping that these websites are showing on your screen. If not, we will make sure that you have access to those websites that you can donate. Thank you all and have a great day.
Thank you, Sora Goings Brown, for that call to action. There is truly power in our voice and our vote. Before we end the program today, please know that your voice also matters in our service to the Las Vegas community. At this time, Dr. Denise Rowe will give instructions on how you can give us feedback on our Breast Cancer Awareness Month events. Dr. Rowe?
Good afternoon, guests and sorors. At this time, I invite you to provide feedback on our breast cancer awareness events by completing a short program evaluation. The link to the program evaluation is provided on the screen and also in the chat box. Please take a few minutes to complete the evaluation. Your feedback is essential to providing program planning in the future. Thank you very much. And now, Sora Belinda Mirintic, President of the Las Vegas Alumni Chapter, will provide closing remarks. Sora Mirintic?
Thank you, Sora Rowe. You know, with 12% or 1 in 8 being diagnosed, Dr. Dawe, we will continue to work to increasing the awareness, encouraging early detection, and stressing treatment advancement education for all in our community. In the words of our survivors, grateful, faith, conqueror, blessed, and courage. We salute each of you on today. We have honored the breast cancer survivors here today with donations to the American Cancer Society, participation in breast cancer awareness events, and this celebration today of their courage. As an organization, we honor all survivors, members of Delta Sigma Theta Sorority Incorporated, and non-Deltas to continue the celebration beyond today and encourage that women and men have a fighting chance against breast cancer. Let's unite to eliminate and bring awareness to this devastating disease. Please continue to donate to support innovative research and vital services. The celebration does not end today. Let's keep it going. And I would be remiss if I didn't take a moment and recognize our Physical and Mental Health Committee, chaired by Dr. Katrina Haslett, our chair for Breast Cancer Awareness Month 2020, Dr. Willie B. Smith, members of the committee, Sora Cooper, Dr. Rowe, Sora Woolfolk, our Membership Services Development Chair, Dr. Rogers, and special acknowledgements, Dr. Dawe, Sora Constance Jackson for providing our graphic design, Dr. Jeff Coate for our virtual walk in celebration of life flyers program graphic design, Samara Woolfolk for the celebration of life flyer design, Information and Communications Technology team from the Las Vegas Alumni Chapter, those who donated to our fundraising efforts, and all of our program participants. Thank you. Although this celebration program is drawing to a close, our passion and our energy for the fight against breast cancer has been ignited with the Delta Torch. To the survivors, thank you for participating and for your incredible courage, which serves as an inspiration to us all. We honor, support, adore, and we celebrate you on today. This celebration of life breast cancer survivors has been a wonderful culmination to our Breast Cancer Awareness Month activities, which included team fundraising, virtual walk, and our celebration of life. Thank you, SOARers of Delta Sigma Theta, friends and colleagues, for your support. It's been an honor for the Las Vegas Alumni Chapter to use its resources and unite in the fight against breast cancer. For additional information and questions, please submit them to lvac.acs.makingstrides@gmail.com, and we will place this in the chat. And on behalf of the Las Vegas Alumni Chapter, thank you again and good afternoon. Now we will end our celebration for 2020 the same way that we began, with a prayer by our chaplain, Dr. Ogletree McGuinn.
What an incredible afternoon. To God be the glory. Heavenly Father, we thank you for this Celebration of Life program, for all the wonderful panelists, the speakers, for the sharing, and for these 10 extraordinary survivors, warriors of breast cancer. Let their fight continue with your help. Empower them with continued grace, hope, and mercy each and every day. Truly, the joy of the Lord is their strength, as it says in Nehemiah 8:10. Surround them with loving care, laughter, and support. Continue to grant them your complete healing and a blessed, joyous life, and blessings to each and every one that was present today. In Jesus' holy name we pray. Amen, amen, amen.